Patient Safety and Quality Clinical Excellence Queensland has developed a podcast series for Queensland Health staff and Hospital and Health Board members to hear from guest speakers on topics relevant to safety and quality in short bite-sized segments. All episodes are recorded on the lands of the Yagara and Turrbal people. We respectfully acknowledge them as the traditional custodians of Meanjin and pay respects to the elders past, present and emerging.
Hello and welcome to another episode in our podcast series. These have been developed for Queensland Health staff and Hospital and Health Board members. In this episode, we'll be talking about accreditation of healthcare facilities and how it applies to our Queensland Health Hospital and Health Services. My name is Sue Hazenberg and I'm from Patient Safety and Quality, Clinical Excellence Queensland. And with me today is Margaret Banks. Margaret is the Director of the National Standards Program at the Commission, which is the Australian Commission on Safety and Quality in Healthcare. Hello, Margaret. Welcome and thank you for joining us today.
Oh, hi, Sue. Thanks. It's a pleasure to be here with you.
So I guess to start, accreditation is a broad word. What is accreditation and why does it matter?
Well, accreditation's an end result. It isn't the process of learning and implementing standards, but it is a formal process, a review. It's undertaken by an external experts where trained independent reviewers assess evidence of implementation of standards. The National Safety and Quality Health Service Standards are used in health services hospitals across the country. And they're a statement of the level of care that consumers should be able to expect from an organisation. And for each of the health service organisations, the standards provide a framework for the safety and quality improvement that occurs. The accreditation is a verification process that those standards are in place.
So with the context that the Australian Commission on Safety and Quality in Healthcare provides a national framework for safety and quality, what is the Commission's role in relation to accreditation of our healthcare facilities?
Well, that's described under the National Health Reform Act of 2011. The Commission's work is stipulated in there, and we are responsible for the formulation of standards relating to health care, safety and quality matters, like the National Safety and Quality Health Service Standards and accreditation schemes. The Commission issues advisories which provide formal guidance on the interpretation and or the assessment of the standards, and these advisories are routinely reviewed to ensure they are current and correct. We also coordinate the Australian Health Services Safety and Quality Accreditation Scheme, and that involves formulating the rules, which we do in collaboration with states and territories, providing oversight of the accreditation process, approving the agencies that undertake those assessments, and we also monitor their performance. We evaluate the effectiveness of the assessment process and we report on the outcomes of that assessment. So the scheme overall describes the processes of accreditation and the roles and responsibilities of everybody involved through the regulators, the state territory health departments, the organisations, the hospitals, the accrediting agencies and the Commission.
You mentioned that the scheme describes the role of the regulator, and as you know, in Queensland Health, that regulatory function is delegated to the Executive Director, Patient Safety and Quality, Clinical Excellence Queensland. So in Queensland Health, PSQ is the contact for our hospital and health services if they have any issues or concerns. Obviously, in our established collaborative partnership with you and your team at the Commission, and also with the certifying agencies that are engaged by our hospital and health services. And by that, for example, we received notification of the short notice assessment occurring at the same time that our services do. Also, the certifying agencies provide copies of the assessment reports, and importantly, they provide the Department of Health with notification if a significant risk is identified during the assessment process. So, Margaret, if we move on from the scheme and the assessment process itself. Could you tell me a little bit more about the National Safety and Quality Health Service Standards? What are they and what is the intent behind them?
Oh, the standards are really important. Their primary aim is to protect the public from harm and to improve the quality of care that's being provided. They provide an assurance mechanism that tests whether relevant safety and quality systems being used and monitored by the organisation. The standards set the level of care the community expects from safety and quality in our health services. There are 8 of them and 151 actions or requirements that sit under those 8 standards. And they include clinical governance, partnering with consumer, preventing and controlling infections, medication safety, comprehensive care, communicating for safety, blood management, and recognising and responding to deterioration. All really important areas in terms of safety and quality. And since 2011, the health ministers mandated that all Australian hospitals and day procedure services are assessed through an independent accreditation process to determine whether they are fully implementing these National Safety and Quality Health Service standards.
And I guess just to that point, that all Australian hospitals are required to be against the national standards, here in Queensland Health, we have an accreditation guideline that is linked to our Patient Safety Health Service Directive that provides some additional and specific clarification of accreditation requirements of our Queensland Health primary and community facilities. Moving on, we've talked about what the standards are and why they are important. Could you tell me a little bit more about how an accreditation assessment is conducted? What's the process for that accreditation assessment?
Well, first, accreditation relies on organisations implementing the standards. So assessors then confirm the standards are in place, and then the accrediting agency determines whether accreditation can be awarded. Assessments in 2 parts, an initial assessment and then a final assessment later if actions are not met or met with recommendations from that very first assessment. There's a remediation period between assessments of about 60 business days in which change can be introduced to ensure compliance with standards. Accreditation is awarded when all the applicable actions are rated met or met with recommendations at the completion of the assessment cycle. The introduction of a mandatory short notice assessment in 2023 ensures day-to-day practice is being assessed and identifies gaps rather than how it was previously, where organisations prepared for an assessment which was an event. The assessments can occur at any time in a 3-year cycle with a minimal notification, somewhere between 24 and 48 hours, provided to the health service organisation. The health service organisation must select their accrediting agency from the approved panel that's developed by the Commission.
Thanks, Margaret, for outlining that process. The next question I just wanted to ask you a little bit about roles and responsibilities. Can you tell me what the definition and role of a governing body is?
Well, a governing body can be a board or chief executive officer or an organisation owner or even a partnership or some other form of high-level governance. Importantly, they are ultimately responsible for delivering safe, reliable and high-quality care. They're also responsible for the corporate management of an organisation. The standards and good corporate governance require the governing body to ensure members of the governing body understand their roles and responsibilities for the standards and the intent behind them. The role of the governing body then is to lead on safety and quality for the organisation, ensure systems and processes are in place, endorse frameworks and key policies for the organisation, monitor performance, really important as part of their role, ensure that members understand their roles and responsibilities for safety and quality, and train them when they're not. So implementing the standards support them to fulfil these functions.
Margaret, you mentioned earlier that 8 standards make up the National Safety and Quality Health Service standards. Are there any key standards that a governing body should focus on?
I'm sure the clinical governance standard, together with a partner of the consumer standards, provide the foundation for safety and quality, which is required to effectively implement clinically based standards. So, understanding those foundational standards is incredibly important. In addition, these standards are designed to support patients, carers, families, and consumers to be partners in healthcare planning, design, measurement, and evaluation. Collectively, this forms a robust clinical governance framework from which services can be provided and improved.
So, within those 2 standards, clinical governance and the partnering with consumers, are there key actions that are specific to a hospital and health board? What are they and the intent behind them?
So, under the clinical governance standard, actions 1.01 and 1.02, the first two, are explicitly the responsibility of the governing body, that is, the hospital's board or hospital and health board. These actions set the strategic direction for the organisation's safety and quality systems. The intent of Action 1.01 is that the Health and Hospital Board, as the governing body, must assure itself that a culture of safety and quality improvement operates throughout their organisation. Its role is in leadership for the culture of safety and quality improvement, and particularly to promote partnership with patients, carers, and consumers. It's also to set priorities and strategic direction for safe and high quality clinical care, and then the need to ensure that the strategic direction is communicated to the workforce and to the community. They endorse the organisation's clinical governance framework. They ensure the roles and responsibilities are clearly defined for each of those responsible groups, so the governing body manages clinicians and the workforce generally within an organisation. They monitor performance, including clinical indicators, and they review reports and monitor the organisation's overall performance. In relation to Action 1.02, in partnering in the clinical governance standard, the board has to address the safety and quality priorities for Aboriginal and Torres Strait Islanders peoples, specifically in their area. And the governing body has to attest to these, to complying with these 2 actions in an annual attestation statement, which is a formal process of recognising and confirming compliance with these actions by the board.
So, just on that attestation statement, I understand that in Queensland Health, the statement is usually signed by the Health Service Chief Executive and Board Chair. But could you provide a bit more detail and guidance around or on the statement?
Sure, the attestation statement must be dated and submitted annually between the 1st of July and the 30th of September. Each statement covers the previous 12-month period. The accrediting agencies reviewed all the attestation statements received for the standards and the clinical trials governance framework for accuracy and completeness. And then the attestation statement should be on the organisation's letterhead using the Commission's template so that we know that it's accurate and current.
Thanks so much, Margaret. Do you have any final specific advice or recommendations for board members or governing bodies?
I would say board members need to remember, along with their corporate governance duties, they have to have accountability for clinical governance. They need to inform themselves about the safety and quality performance of their organisation and provide clear directions on where improvements are to be focused within their organisation. Their role is to ensure they have the skills to perform the functions and ensure that performance is up to scratch.
Thank you. We have certainly covered a broad range of information in relation to accreditation of Queensland healthcare facilities, and I really do appreciate your input and your time today.
Thanks, Sue. It's a pleasure.
That draws a close on this episode. Further information regarding accreditation can be found online on both the Queensland Health and Commission websites. Thank you for listening.